And when you were told you had thyroid cancer, tell us about that.
Yeah, so that was a pretty scary moment. Once you hear the C word, you have that initial shock at first, and you start panicking, and you just are overwhelmed with stress and grief. And honestly, I cried for like days.
But to lose your thyroid and lose the factory that in your body that routinely gave you this is really a real disaster. Nothing like your own hormones that comes from your own factory. And if you can avoid the general anesthesia and the surgery and the procedure, this will definitely improve both your lifespan and your health span.
Hello, everyone. I'm Philip James. You might know me from the Dr. Thyroid podcast. I'm standing here with Vanessa and her doggie Luna from San Diego, right?
Yes.
We're in a park in New Orleans, Louisiana. And why are we here? Because Vanessa had thyroid cancer. She had a nodule. And she came here to New Orleans, to Tulane University,
Yes.
to get treated for thyroid cancer without surgery.
Exactly. Yes.
So you had the procedure
I did 3 months ago.
and no more cancer.
No, it's gone. The nodule is completely undetected under ultrasound.
How long ago did you discover you had cancer?
I discovered I had cancer back of April of this year, April 2024,
Recently.
recently.
How big was your nodule?
The cancerous nodule was 1.5 centimeters.
And how did you discover it?
Well, over the course of 2 years, I was having a lot of symptoms, night sweats, rapid weight gain, and I just overall did not feel myself. I knew something was wrong. So I went to a few different doctors and no one could give me an answer. And I did a lot of research, and someone on the internet had similar symptoms of mine, and they had thyroid cancer, and I never had my thyroid checked with an ultrasound. So I went into the doctor's office and I asked my doctor to check my ultrasound, to check my thyroid with an ultrasound, just to rule out any potential thyroid issues. And they did the ultrasound. It came back with a nodule. A few weeks later, I had a biopsy, and that's how I found out that I had thyroid cancer.
And when you were told you had thyroid cancer, tell us about that.
Yeah, so that was a pretty scary moment. Once you hear the C word, you have that initial shock at first, and you start panicking, and you just are overwhelmed with stress and grief. And honestly, I cried for like days, and yeah, it was pretty overwhelming the
Do you
first
have
couple
anyone to
days.
support you through that?
Yes. My cousin was in the room with me when I found out, so I had her support, and my sister as well.
And why not just do the surgery?
I've thought about that, and to be honest, becoming having hypothyroidism is what made me not want to do the surgery. I would have to spend my life, taking medication, and I've just heard a lot of bad stories of people dealing with like mental illness and not just really having the same type of functioning body that they had prior to the surgery. So that's what made me want to keep my thyroid.
Can you share with us what happened on the day of your procedure?
So the day of my procedure, when I got the ablation done, it was pretty easy. I went into the office, filled out some paperwork, waited about a half hour for it to be, the time of my procedure to come. Yeah, honestly, they went in with the ablation and targeted the nodules, and I was in and out within 20 minutes of the procedure, and went back to my Airbnb the same day.
And did any doctor recommend surgery?
Yes.
Can you walk us through that?
Yes. So when I first became diagnosed with thyroid cancer, the endocrinologist that I was working with, he immediately wanted to start the procedure, the process of me going and having surgery. I, was very hesitant. I asked him like, hey, is there anything else that could be done? He said no. Surgery is the standard of care, and something just didn't sit right with me. I felt like I should do my own research before just taking, his opinion.
Can you share kind of your experience with Dr. Kandil compared to your initial experience with the doctor in California who wanted to do
Yes.
surgery? What's a different patient experience?
Night and day, so different. My doctor back in San Diego that told me that I should get surgery, he didn't offer any other alternatives. He was very rigid. He said, this is it. Either you'd have the surgery or you don't. And he made it seem like it was the end all be all. With Dr. Kandil, his approach is a lot different. When I first spoke to him, he told me my chances. He provided me with data, he would send me use cases and studies just so I can see the data myself. I'm a data-driven person, so when he was able to share that information with me about the success rate with the ablation and the type of cancer that I have and how I'm a good case study for this, that made the world of difference, and the type of care that he provides is phenomenal. Yeah.
What are some resources that you discovered that were really helpful in your journey?
That really helpful in my journey. Honestly, I'm a millennial, so I use social media. So the TikTok, YouTube, that's where I went to try to figure out what else is out there. And once I started hearing people's stories, I found Facebook groups and just hearing testimonies. That's really what
Patient testimonial.
Patient testimonial of who've done the ablation. That's when I was like, okay, I want to go this route. I just want to say thank you, like yourself, thank you for putting this out there. The information wouldn't be obtainable unless people were actively putting it on social media, and that's how I found it. So I'm super thankful for the ablation, for it being available in the US. I'm thankful for Dr. Kandil. I'm grateful for everyone who shared their testimony and patient testimonies about ablation, and just having the courage to share that information so that way people like myself can find it online and be able to make, proper decisions that work for oneself.
Fantastic.
Yeah.
So now, for those watching, you're going to enjoy your day in the park.
Absolutely.
But I'm going to go talk to Dr. Kandil about your case, and I think he's going to share more details about what it was like being your doctor and how he approached the treatment of your nodule. So I want to thank you.
Thank you.
We're going to say farewell to them for now, and I'm going to go over to Tulane University and see Dr. Kandil. Yeah. Dr. Kandil, I just talked to your patient Vanessa at the park. She was telling us how you treated her for thyroid cancer without surgery.
Yeah, Vanessa is a very nice, wonderful person. She called me and we had a consultation, discussed her option. Initially, she was offered thyroid surgery to remove her entire gland because she did have a nodule and the biopsy was cancer, which is appropriate. However, there are other options, and we discussed the ablation option. And we performed that, and she did extremely well. And after just 3 months from the ablation, the cancer does not exist.
Does not exist.
There is no evidence of the nodule on her ultrasound.
How large was the nodule?
So her nodule was approximately 1.6 centimeter. And she went back to the same place that did the first ultrasound and did the first biopsy, and they were unable to identify the original nodule that was seen on the first ultrasound where they found about this suspicious nodule. And she came back to see me, and again, there is no evidence of any residual disease after the ablation.
Pretty cool.
Yeah.
And I don't think there's much more to talk about this, except I think we should just do one thing. Some people might think this is hocus pocus because perception is cancer, and then sometimes we always are told to be skeptical of some cure-all. We can take care of your cancer without cutting you open. But I just think we have to emphasize again that no, this procedure, ablation, is being used to treat thyroid cancer successfully in all the some big institutions around the world. can we just reiterate to the patients listening or watching that this is real?
Absolutely. So active surveillance, which basically monitoring thyroid cancer without surgical intervention, is an option for many patients with thyroid cancer in a very early stage with a small disease. And this is actually the most common scenario for patients with thyroid cancer. So these patients can just basically do nothing with making sure that they are good candidates for this approach. But now we do have an approach where we can burn the nodule and make it disappear, ablate the nodule completely. So patients should be aware about the possible opportunities for them to preserve the thyroids.
In the description to this interview, whether it's podcast or video, for anyone watching or listening, they're going to find your info on how to contact you if they have thyroid cancer or thyroid nodule, on how to be treated without surgery. Any final thoughts about Vanessa's case before we say farewell?
Well, I think it's important to understand that almost 80% of well-differentiated thyroid cancer is an early stage disease. And many of these patients can be really managed without aggressive treatment. Preserving the thyroid is really the key element here of these approaches, the ablation approaches. You can have a great surgeon who can have almost a 0% complication risk, which is possible, but to lose your thyroid and lose the factory that in your body that routinely gave you this is really a real disaster. Nothing like your own hormones that comes from your own factory. And if you can avoid the general anesthesia and the surgery and the procedure, this will definitely improve both your lifespan and your health span.
Awesome. So, for those of you watching, the link to Dr. Kandil is in the description to the video or the podcast if you're listening. And Dr. Kandil, anything else for those watching?
Well, Philip, thank you very much for coming.
Thank you. It's great to be here in Tulane, in New Orleans. Everyone, farewell.